All right, so let's see. I think we're going to get moving. It's just a few minutes after 12. And let's see, numbers are still going up, so I feel kind of bad if people are having trouble logging on, but we can always have the playback sent to you guys. So we're going to start by introducing ourselves, and we'll let you go first.
Perfect.
Okay.
I'm Sherry Quinn. I am the Merz representative for Ultherapy. I've been with Merz for 5 years, and I've been with Ultherapy for about just over a year. So I'm super excited. I absolutely love the treatment, totally believe in it. It really, really works. And I've been working with Jill probably for longer than a year because she uses our skincare too. But I'm so excited to have Jill doing this treatment in here for you guys, because I know that she has been literally doing it since probably the day it launched.
Yeah,
I think for a really long time. So
my favorite thing.
She's kind of like the Ultherapy OG. So yes. Awesome provider. And I will say that that's one thing that really, really matters is who you go to, if they're really experienced with doing it, if they keep up with all of our protocols and all of the new things that kind of come out with the treatment. So, and Jill definitely does that. And we're so excited to actually have her as one of our clinical educators now. So
thank you.
Yeah, so excited. I recruited her. So
you did.
I did, yes. So she's actually, what that means is she goes into other accounts and she teaches other providers how to use Ultherapy. So I always said if we could clone Jill,
so nice.
my territory would really be rocking and rolling. So the next best thing was to make her an educator so that she could go in and train other people to do what she does. So you're welcome. So that's kind of my little segue into Jill.
So my name is Jill Gunton. Most of you, I hope I've met most of you. I've been with the Parker Clinic now for more than 6 years. I started with Ultherapy with Dr. Goldman down the street, and very good friend of mine. I worked there 16 years. He's a wonderful doctor. Came down to the Parker Clinic 6 years ago, and Dr. Goldman and Dr. Parker got their machine the exact same week. It was kind of funny. They weren't supposed to sell them that close together. It was kind of a thing where we bought ours and the other one bought theirs, and it was boom together. And it was really actually turned out to be a really good thing because both clinics use the machine well. And I feel like, you know, the more positivity rate we get out there with Ultherapy, the better. And the treatment has definitely changed, which is what Sherry is saying. So that is a very big determination on some of the things you'll see online of why things aren't working. So they have indications for the visualization on the screen, which is huge. And that means when we're looking on the screen, similarly to when you look for a baby on a screen, when you're getting an ultrasound, because that's what this is delivering ultrasound, you're looking for the actual levels of each person's collagen. And it can be different on the right side to the left side of your face, certainly under your chin, your neck, and your décolleté. So I think those are really big differences. It is a 2-pass. So we both have 2 levels of collagen that we're going to wake up. No other skin tightening machine has that. And it also has an indication for lifting from the FDA, which is huge. So when you feel like some things on your face want to slide down a little bit, and sometimes we go to the doctors and we go to the nurse injectors for the lifting of the cheeks and things like that, we really want to work at the basement and work underneath the skin, which is why this is so important. Microneedling kind of does things on the surface like peels. This is down low. It's getting that collagen to remodel, and it's your own tissue, which is so important. Nothing is injected. We're not doing anything like that. So I think historically, you know, because it has changed, it has actually gotten better. And I'm very happy to be helping people, you know, around the country learn how to do the procedure better. I actually don't teach anyone in my territory here. It's all outside. So I'm either in Sherry's far outskirts of Cleveland or I'm in other areas of the country. So and I'm also doing an off-label clinical trial for them, which is wonderful. So it's very quiet, but it's really awesome. I'm learning a ton with the clinical education side, which has really been amazing. So we're going to start with a little video here that we have for you, because I don't know how many of you are new with the procedure, understand it, and it's something that kind of really goes over everything. You can throw some of the questions in. There are quite a few of you, so it's going to be hard to answer them all. The one thing I will say is the first 20 people that schedule, And I think we've upped that to 30 now, do get the gifts of the neck cream, the bags and things like that. So we try to make sure that everybody is taken care of. The neck creams are generously donated by Sherry. They're wonderful. They're great for after having your treatment done. We do retail them then, which is really great. And we like them a lot. We may end up doing a few eye creams if we run out of some of those, but their eye cream is awesome as well. So, and the bags are generously also donated by them, which is wonderful. So we're really excited to be able to give those things to you guys. So I'm going to go ahead and try to get down to this video here and let you see this. Okay. Okay. Then you'll see, you'll be able to hear. I'm not hearing.
With age,
Okay,
skin loses its elasticity, and the signs of aging become more visible. Beneath the skin's surface, structural proteins such as collagen and elastin fibers stiffen over time. This leads to a decrease in skin's elasticity and contributes to the sagging and the forming of wrinkles. Ultherapy is the natural choice for a non-surgical way to lift and tighten skin using safe, time-tested ultrasound technology, and is backed by 4 unique FDA indications and research from over 50 clinical trials. Using micro-focused ultrasound, along with its proprietary deep-sea ultrasound visualization, Ultherapy delivers energy to where it will be most beneficial, leading to a lift of the neck, chin, and brow, and can also improve wrinkles on the décolletage. Ultherapy reaches the same deep tissue layer as surgical facelift addresses, but without surgery or downtime. During an Ultherapy treatment, ultrasound waves are micro-focused at the precise depths in the dermal and subcutaneous tissue, sparing the skin's surface and intervening tissue. Friction heats the tissue to between 60 and 70 degrees Celsius, forming thermal coagulation points at depths of 1.5, 3, or 4.5 millimeters. Delivery of ultrasound energy in this manner causes contraction and denaturation of collagen and initiates the body's healing response, resulting in collagen synthesis and tissue repair. This new collagen growth leads to natural-looking results that accumulate gradually over the course of 2 to 3 months, with visible improvements that can even be seen a year after treatment. Ultherapy is the first and only FDA-cleared procedure to non-invasively lift the eyebrow, neck, and under the chin, and is also FDA-cleared for improving lines and wrinkles on the chest.
Okay, so now we're going to get started on the PowerPoint just so that we can kind of go over everything. I want to see if there's anything that dropped down here. Can you hear us now? Yes. Okay. Sounds like I'm hearing yes. Okay.
All right.
So we have an understanding of how the energy is delivered. The ultrasound is delivered. We saw the different points, the coagulation points. I don't know. Here we go. This one. Nope. I gotta try to have this move. I think these all flipped upside down. Oh my goodness. Let me see. All right, Miss Nate. Oh, there we go. I got it. I don't know unless it went. Here we go. Okay, there we go. All right.
Perfect. All right. So just to kind of run you through a little bit exactly how it's working and what it's working on, there are a couple of things that really contribute to aging. One is going to be collagen, which I'm sure everyone, you know, it's the huge buzzword, especially right now, collagen, collagen, collagen. We're eating it, we're drinking it. That's the secret sauce to lines, wrinkles, and lifting and firming. The other two are elastin and then also hyaluronic acid. So really, Ultherapy is really focusing on collagen. That's what it's actually doing, is stimulating collagen. Unfortunately, we lose about 1% of collagen a year after the age of 25. So, you know, I mean, you can do the math. That's kind of a little scary when you think about it. Elasticity and hyaluronic acid, we start losing in our 40s. So those are kind of like the benchmarks, not everyone, but those are kind of like the benchmarks as far as, you know, age goes. So really, like I said, you know, Ultherapy is really focusing on that collagen production. And what makes it really different is that it's focusing on mature collagen. So not just like new young collagen, but collagen that has been stagnant. So that's like the big difference really as to what it's doing. Yeah.
This explains some of the aging on the face that you can see with the loss of volume and some of the sagging and the changing that you have over the years.
That's all due to the depletion of collagen and elasticity, basically.
The sun, so many different things,
Right.
hormones, if you've had a, hysterectomy early, things like that.
Yeah.
So this is kind of explaining too, the weakened, how things are weakened, how the ultrasound goes back in, and then it mimics more tighter, healthier skin. This does start, they say, in about 3 months. Some people say that they can feel it when they leave. They're like, I felt this funny tightening underneath my skin, but I didn't know if I was just wanting to or if I actually did. Then I feel like when people have it a second time, they're like, no, I definitely feel it. And what's weird is I could tell when it was wearing off. I don't think I could tell as much. And it's not that it wears off, it's that your body continues to age at the age you are. So we want to continue to keep that collagen remodeling naturally in your body. Right. It's definitely the gold standard as far as non-surgical lifting and skin tightening goes, right. I would say.
And I think what really this how it speaks to me is that we received this gold standard award not by just like Jill and myself, but this is like physicians around the country and around around the area obviously that work with it that really believe in it. And to get that FDA approval or that clearance, basically it has to work and it has to be safe. So those are, two really, I think, important things to really realize with Ultherapy is that to be able to get this recognition, it has to work and it has to be safe, especially to get those FDA clearances to be able to do the treatment.
95% satisfaction rate is reported typically with an Ultherapy treatment, which is wonderful. Some people do actually have this done. If you have had a facelift and you feel like your skin is sagging a little bit, you've tried laser and you kind of wish, you can actually have it done even after a facelift. Although most people that start it early find that they don't need facelifts when you're combining it with lasers and fillers and things like that. Some people don't. Some of my patients don't want filler. I think filler is awesome. We absolutely love it here, but not everybody, it's not for everyone. So this is a prevention kind of a thing that you can keep your collagen remodeling and keeping your skin happy, things like that. And it is, again, beneath the skin is what's so important. A lot of people, if you think of like when you get microneedling and lasers and things like that, it's sort of like getting your lawn aerated. This is more like where the pipes are in the ground. We're looking for that deep connective tissue to really get the microfocused ultrasound down to the proper depth that is, again, all designed by us having that indication for the imaging on the screen, which is really what I'm trying to tell you when I say I'm looking for imaging. Right along in this 3.0 area, you're kind of seeing where the energy gets delivered. In other words, if I used the 4.5, which you see it is not illuminated here, it's very dark. When this treatment first came out, everybody got a 4.5. They have changed that significantly, and you need to continue your education with Merz to know, the right areas for each patient. And again, it can even vary from the right side to the left side. So that means on the right side of your face, I could be treating in a 3.0 so that I'm waking the collagen up there. And on the left side, I might be doing the 4.5 because that's what you have on that side. That is not the way it was originally trained. And so I do think it makes a very big difference in what you're seeing across the country as better outcomes of the procedure.
Correct. And I think really another huge point of difference is that we have this ultrasound where we can really see each person's individual collagen and where it is as far as the depth goes. Because mine is going to probably be completely different than Jill's or anyone else's. Not only does it vary from side to side, but from patient to patient. Definitely. So it's really important. And I think it's a huge point of difference. No one else has this technology where we can really pinpoint where we want to stimulate and wake up that collagen.
Yes. And some people too, they'll say, well, I had this done at another office and, she used this or this or this. And even if I treated you, 4 years ago, 5 years ago, you don't want me to just look at your old treatment plan. You need me to visually use my screen, visually figure out what you need at this stage of your treatment and your age to give you the outcome that you're looking for. So it's not like let me just see what I did on you last time. It is a very moving forward treatment that we are trying to keep at the forefront of the healthy aging. And you want to explain this one? This one's a good one.
Yes, I love this slide because
I
it
do too.
really kind of shows you exactly what different things that you could be getting done in the office, what they're doing and where they're actually going. So as you can see, the surgical facelift is going to go all the way down to the deepest layer of your skin, so the 4.5. The next is going to be lasers. And like Jill said, lasers are great. They're really focusing on, you know, those top layers of skin. So it's going down to that. Yeah.
Fine lines, things like that.
For sure. So it's really kind of a surface treatment. I'm going down to the 1.5. Radio frequency is going to kind of be like your microneedling. Again, awesome. It is going a little bit deeper, not quite as deep or not as shallow as the 1.5, a little bit deeper. Another great treatment for surface pores.
Yes.
It will stimulate collagen a little bit, but it's not going deep enough, and the frequency is not hot enough to really wake up that collagen.
Yes, and also when you are doing radio frequency things, it's going to be more one layer. So it would be like if we did thermage, for instance, we would be treating this area and we would be heating the area up at the exact same temperature, staying in that spot. But you know, what I love about Ultherapy that is so different is you're getting 2 levels. Every person, it's a double pass, and that is very important for the 2 to kind of work together. So that's where I think radio frequency is really the best in microneedling. Thermage is wonderful if you need your eyelids, your body, things like that. We think that's, you know, a very good treatment there.
Correct.
And then you're looking at your micro-focused ultrasound here on the end. So it's telling you that you can be in this 1.5 area. You can also be in the 3.0 area or the 4.5. And like Sherry said, it does vary patient to patient. So it needs to be customizable. It's not a cookie cutter flow chart, basically. That's the best way to put it. You need somebody that can look at that screen and know what is going on with your skin and how to help you the best, and, you know, and keep your healthy progression going. And I think some people get confused, like if several years ago I might have used the 4.5 on them, and maybe they've looked at some videos and they're trying to figure things out, you know, and they say, well, gosh, this time you only use the 3.0. That doesn't really matter. It's just your own body's breakdown of what's going to happen whether you're doing Ultherapy or not. We all age differently and at different speeds in our life, I would say. So this helps slow everything down nicely.
Absolutely. And I love the fact too that, you know, Ultherapy is, if you can see, is going as deep as a surgical facelift. But the beauty of it is that, you know, there's no downtime. It's not this super, you know, dramatic result. It is going to be gradual and not quite as, you know, oh my gosh, what did you have done type of thing.
And they piggyback over time. Like people that have had them, I actually have a lady who I've seen for years from the old clinic to this one. She's wonderful. I love her. She's in her 70s. And what she's so cute, she said, I went to this family reunion and people thought I had a facelift and I don't even have filler. And I just feel like she started to cry, and I thought it was so sweet. And she's like, I know I don't look like I've had a facelift at all. I just look well rested. So they think I did something, you know. She's like, I've done peels, I've done a little microneedling, I've done a boatload of Retin-A, and this Ultherapy I think has really, she goes, I just wanted to make sure before I, you know, decided to get medicated and you were going to treat me, that I wanted to thank you. And so she hugged me, and I thought that was so sweet, because I'm like, oh my gosh, she's been around for years and, you know, she feels good. And that's really at the end of the day why I'm here and doing my job, is to take care of people that want to, you know, improve how they feel. So this again explains when the energy is being delivered. It's this little tiny piece here, the center of the hand piece, and it's micro focused down to a tiny little point at the bottom, which is really interesting. So it makes these little dotted lines of at each level. So this one is describing that it's at the 3.0 level of the skin.
Yeah. So those are like little wounds that are actually happening with that transducer and with that micro-focused energy. So when we refer to energy, it's just the pulses and the little tiny wounds that are happening to your collagen underneath the surface of the skin. So what happens is when that collagen is wounded, it goes into kind of like this defense mechanism where it's going to start regenerating itself. Your own tissue is going to start regenerating itself. And that's where you really get that lifting in that 3 to 6 month time period. If you can think of like a child and like how, you know, when they fall and they get a scraped knee or something, it really heals quickly. And the reason that it's healing quickly is because they have really great, strong collagen that is, you know, kind of, it's not broken down yet. They don't have that aging process. Where us, it takes a little bit of time. So that's why it's that 3 to 6 months.
Yes. My slow healers will even go into 9 months. They'll say, I'm still seeing differences between 6 and 9. Usually it's typically a little bit of an older patient. So then we have a few of the before and afters that are from Ultherapy. You can kind of take a look at and see. They give you different timelines of, you know, early. This is a younger patient for sure. When somebody starts younger, I think it makes, you know, all the difference in the world. You know, you can do it later though. I mean, there are people that just say, look, I'm never going under the knife. I don't want to. You know, I just don't want to do that. So, you know, you're going to see a nice improvement, but you're not going to look completely different. If this were my patient, I would still recommend seeing, you know, our physicians, our nurse injectors and things like that for some fillers, because it will just help. But at least you're supporting all the structure under your skin to hold some of those treatments.
The jawline in those.
The jawline is really great.
The improvement there is great, and that's where a lot of people notice that the gelling.
Yes,
and
definitely.
they can really get that sagging in through that area.
Yes.
These pictures are really a great example of the definition that it's really giving into that jawline for sure.
Yes. And so here is where it's kind of just telling you the different areas that it can be done, areas of concern. It came out originally as a non-surgical brow lift, and then it continued on down the face. So when we work in the cheek area, we're definitely working in this lower level here. So it's kind of pulling this area back and up, which I think is so important. So that it will take the weight off of the face here. Similarly to if you've had voluma or any kind of fillers along in here, you know, we're not going to treat right over top of that. We don't want to stamp that down in any way or mash it down. These are beautiful areas of the face that we want to stay naturally constructed and look nice. So we work on this, you know, under the eye, definitely in the temple, and then raise this brow area really nicely, which is so great for just for the, you know, the construction of the face.
Right.
Like
and I think in clinical trials, correct me if I'm wrong, but they saw a 2 centimeter lift in that brow area, which is comparable to a lift.
It is,
yeah,
which is really great. So I think, you know, if you freeze your forehead with some Botox, it's wonderful. Then you can't make all the little wrinkles that are going to go side to side, but that lifting of the brow naturally, that you're not letting it drop down, is so important. So that is, yes, that is true. Thank you. So then we'll see some of these eyes are really great. The hooding can be considered more gone. The lifting in the brow area that you're not seeing on some of these. Here in this first photo with this hooding, you know, she's got it lifted off of there. And so that is significant. And a lot of people really love it. I mean, I will say, people sometimes say, well, the first time I did it, I wasn't so positive, but now I've done it a second time, and I definitely, I know, you know. So it's something that people usually do yearly, every other year, depending on the other things that you choose here at the clinic. You know, you may want to try a different provider, try something different, and then come back and see me. We highly encourage that, just so that you can get many different aspects of how you feel and you look, and your look is changing. This is quite nice here. Sometimes people will do some Kybella. Cool sculpting is really wonderful for under the chin area here. And then they're going to feel like they've got a little bit of loose skin. So Ultherapy is great to kind of help with some of that, keep that changing. If you've got, you know, more of the fat deposit in these areas, I would say we'll check with the doctors. You know, you may want to do that first. I have a lady that just did her face. So face is usually right underneath the chin, and all the way up is considered full face. So if you were going to do Kybella or cool sculpting and really wanted to get started on your face with Ultherapy, I could just go to your bottom of your face here, wait until this heals, and then we could go back and treat with Ultherapy over it when you were done for some of the
fantastic result.
Tightening. It is. It's some of the tightening and loose, you know, everybody's kind of got their own little wants and things that bother them. So these are really, really nice for neck. You know, some people with some of the bands, they'll need some Botox and things like that to loosen some of the tightness of the bands, the platysmal bands and things like that. But you know, again, you're seeing the doctors or things like that to kind of have some of that consulting and follow up just to make sure that you're happy with what you're getting here. I think this is quite nice. You can see some of this really, and that's what I'm talking. When you see this down here on the bottom of this patient, you're working in this area and you're getting some of that lifting that's going up, which I think is so important over time to change the face.
And I think
décolleté.
that neck area, a lot of our younger patients
Yes.
are really seeing those horizontal lines. I've been doing it a lot.
Yeah.
I think it's just like we're in the day of Zoom and we're in
Right.
the day of technology
Right.
and our head's always down.
Yep.
So, you know, it's just,
We
it's
want to work on that. Yeah.
exactly. It's very popular amongst our younger patients as well.
That is actually the reason our biggest thing that we do here is face, neck, and chest. And the reason for that is if you do your full face and you do your neck, you get your chest free. Some patients have a beautiful chest. Not all of us have a Dr. Parker chest. Her chest looks like it's like 10. I don't know. I'm not even kidding. Like no sun. Yes, it's crazy. Her skin is so amazing on her chest. But so you can take the lines that we're going to be put on your chest and I can use them on your neck if your neck is really bothering you. It's just a way that you get a specific amount free of the treatment. So if it's like, gosh, Jill, around my mouth is bothering me, my jowls, I would add it to your lower face and your cheeks. You don't have to get your décolleté free with the with that option. It's just those amounts. So it's $1,100 to do your chest. And I would just take the $1,100 treatment that we do down here and move those lines somewhere that would be more helpful for you, which is no problem at all. But a lot of people, I will say, forget about their chest. You know, if I had this patient here, the second one, I would do some peels and things like that first and kind of get that skin a little brighter, a little healthier, maybe even have her do a laser, you know, first, and then maybe we could do some of the tightening there. This chest, I think, is a better candidate for it, and down here is pretty good. I just can't tell if some of this in here is hyperpigmentation a little bit. It looks like
It looks like a lot of sun damage.
A lot of sun damage, you know. So again, you've got to do some hydroquinones, retin-A's, and things like that to keep that skin healthy. But keeping the collagen remodeling is never a bad thing.
I
So
think we kind of forget all about our chest.
we do.
So when we're
We do.
doing our skincare or something like that, we kind of stop like right at that chin,
Yep.
not realizing that we really need to extend that
Yep.
down to our neck
Mhm.
and our décolleté
Right.
to make sure that it's being protected as well.
Yes. And they're just basically saying that this is a treatment that you can do during the day. Excuse me. If you have a low pain threshold, we can give you medication. It'll have to be determined by the physicians, you know, before we start. My favorite thing is honestly Pronox. It's half nitrous oxide, half oxygen. You can drive yourself. It's very simple. It wears off. Again, there are medical things that the doctors will determine if you're a candidate to have either one of those options. I am not a physician, so I can't do that for you, but they definitely come in and make sure that everything is good on that platform. And it's the easiest. A lot of people are going with the just taking some Tylenol at home and doing the Pronox. So I think that's a very easy way to have it done. I would say 30 to 90 minutes is what it's saying here. That's about right. If you do face, neck, and chest, it's about 90 with me.
I think the Pronox too has been a huge change
Huge change.
in the treatment
Yeah.
itself. Not
Yeah.
only the technology and the protocols, but adding in that Pronox, I think, has been a game changer.
Yep.
For a lot of patients as far as like pain management.
Yes.
It's like a really good.
Yes.
thing how it goes.
I agree.
Mhm.
So over here, it'll say, you know, slight lifting and plumping of the fine lines. I think it's the swelling, but I think the slight swelling gives you a really good indication of, ooh, I'm going to watch those spots because those are going to be what gets better. And people tend to notice that. Redness is very minimal. Typically, if I do the right side of your face and I finish it completely, and then I go to the left side, the right side isn't even red anymore by the end. You can have little teeny tiny some swelling, but nothing bad. It's got one of the smallest release forms in the practice. Honestly, it's very safe. You know, I think the biggest downside is if it wasn't enough for you. I would say like you were bummed, you wanted more, you know, something like that. It's not necessarily like a damaging thing. Like, oh my gosh, you could hide it from your, you know, significant others if you wanted to. We don't recommend it, but you can, because I don't think nobody's going to know,
Yeah,
you know,
no,
you're not bleeding, you're not peeling. I know when I come home and my face is beat up, my family gets pretty mad. They're like,
Yeah.
what did you do with Dr. Parker? You know, so it's always, if I get something done, people want it to be more natural. And then you're going to see that starting lifting in the 3-month period, right? Which I think is so great. So I think, you know, additional lifting, like I said, does continue all the way through 6 months. If you're a slow healer, meaning like Sherry was talking about that wound heal response inside your body, you're going to do the most between 6 and 9 months because you're just a little slow, kind of an inchworm, versus somebody else who's got major swelling and whoa, their body's just going to town healing. You're going to see it faster. I have some younger doctors that I did recently. They were like a dead race. They were funny, you know, texting me from downtown, like, oh my gosh, is it weird that I love my Ultherapy this much? And it's been, you know, I'm joking, 10 minutes, but it was like 10 weeks or something, you know? And I'm like, no, I mean, if you can see it and feel it, and, you know, they think they could notice it in pictures and things like that, which made me feel really good. So they were.
Look at ourselves every day.
We look at ourselves bad. I don't
We
know
do.
why. We're our own worst critics.
But I think that, you know, when something like this, like a procedure like this is gradual and we are looking at ourselves every day,
Yes.
sometimes we don't realize it until we see
Right.
a photo or someone is like, oh my gosh, you look
So good. What are you
amazing.
doing? You know, and then
Yes,
they're like,
exactly.
oh, you know,
And then you buy and you're like, I'm eating great and drinking a ton of water.
yeah, ton of water, no wine ever, right? Yeah. Potential side effects here, you know, flushed appearance. I mean, I really don't, 72 hours is really tingling and tenderness. I will say that's the second one. When we do the forehead, you've got nerves that are traveling to the back of your head. I've had patients say, uh-oh, you're pulling my hair. And I'm like, no, it's just your little nerves. I'm literally getting on them. And it travels to the back where you can feel it. And it really kind of bothers you. But other than that, I don't, you know, there's not a lot of any kind of major, you know, issues there. Yeah. So I would say, you know, definitely get in here so that we can give you, if you are brand new and you've never done it, I would love to see you so that we can talk about all of the possible worries that you have. There's so many people, it's going to be hard to answer a ton of the questions, but you can definitely email me, jillg@theparkerclinic.com. I'll definitely, you know, reply, send stuff back. Consultations, sometimes they charge you $75, but I believe if you attended this, it's free. And then you can get in here and really see these treatments need to be scheduled by January 31st. My November and December schedule is a little heavy. I'm not going to lie to you guys. I have a lot going on and a lot of people that have scheduled ahead of time. People are tired of being home and not doing anything. So I'm super thankful for that. So I'm extending it a little bit just because of scheduling. Make sure, you know, email me again. Hey, Jill, like I attended the event. I really want to see you. I don't know what's going on. I do come in and work my days off. I'm kind of crazy because I love being here so much. So I have days that are set aside that are shut down that I'm going to open. So the desk knows about it. There's some areas that are literally on there that are not being scheduled for other things that are just strictly for you guys. So the specials are going to be the full neck and chest. You do not have to do them in the same sitting. You can do them separate. You will get your chest free. Those lines can go anywhere. If you're going to do full face or lower face, it's going to be a little bit cheaper than the original pricing if you just came in. And it does vary a smidgen. It depends on if I have a tiny little person, if they need more lifting. So it is a customizable thing and it's not an exact price. That's the hard part. But I make sure that what you're getting free is worth your value. If you're not doing the big one, that's fine. So full face, just as a general idea, it would be $3,200 to $3,400. So it would probably be less, you know, it will be, not probably, it will be less than that because we're going to take out the cost of the eyes and the lips so that you can get that. And, you know, if you're a water bottle person, you never smoked, around the mouth makes you crazy, we'll add more lines around the mouth. And it does really help flip your little lip, kind of like the Botox flip does. It's really great and works on those fine lines. Your neck and under your chin may be because I just did you and you're like, gosh darn it, I had my full face. I love it. I totally would have done neck and chest and now I'm really sad. So I added the neck and under the chin so that we could try to do eyes free. Who doesn't want their eyes done a little extra? It's why we get Botox every 3 months, right? So that was really where that option 3 came in. And you know what? I'm fine with working with people. You know, if you're somebody who has had this and really wants it and, you know, needs something special, you can always, you know, reach back to me. And then Nina, I'm going to try to get back to I don't know where I go to see us. I might have to have her help us. Let's see. Have I had fat loss in patients? No, that's a good question. I would say, I don't know if you can get us, can you see us? I just can't see me. Oh, good. Okay, well, hi, I couldn't see myself. Right, okay, good. I have not had fat loss in patients, knock on a giant pile of wood, no. I think that would be if somebody was, I think maybe like China or something where they're doing things maybe more off-label than we are. That's the only thing I can think of. Have you, like, I don't.
Really, if we could dissolve fat.
Right. Yeah, we'd be doing a lot more.
Yes, we'd be doing
Very,
a lot more.
very good question,
Yes,
though.
it's a very good
And
question.
we do have fat loss in general.
Well, I think too, when you're lifting and that fullness is kind of shifting, sometimes it looks like that.
That's where I was saying with the treatment. Again, I try to stay off of that, whether you've got filler or not. I don't want to pound here. So some people will say, well, gosh, you missed my cheek. It actually shows there's like kind of a no fly zone, right? And that is because we've got our own natural fat there. Right. And when Dr. Parker adds some things so that we don't have our temples sagging or things like that, we don't want to pound any of that down. We want to get this down and sort of back so we can try to lift a little bit under here and work the face the proper way. And again, those little water bottle lines and these little guys, we can work on those really well. How is it different from thermage? I don't know if I covered, if you understood that, but thermage is going to be the radio frequency, and I'm heating the area up. So we're basically on an area with a one temperature, and it is not double layered. So that's very important. It is different. It just does not have the eye capability. So if you wanted your eyelid treated, Asian patients, things like that, some people really love their lids done. Dr. Parker can put eye shields in, and then we can actually treat to the actual lid that's going to feel more like a trampoline, where you don't have any bone or any tissue. So that thermage does do, and thermage does body, which is great. It's got a bigger applicator. So when we fire the energy into the skin, you can get a bigger space where we told you it's all there is that little tiny line of the destruction of the tissue down low. I hope that helps to understand that. My email again is jillg@theparkerclinic.com. Email again, jillg@parkerclinic.com, @theparkerclinic.com, sorry. How many treatments? Really, it's one, which is crazy. So if you did full face, it would be under your little chin. Up is considered face. We're not going to treat in the front of the neck here because of anatomy. So if that really bugs you, we sort of slide your skin over and treat it, and slide your skin over and treat it. But it is 3 rows all the way down your neck, because just like this pulls back, we want your neck to pull back as well. We want to work on that area. So if your neck is really bugging you and you're like, boy, I really let it go a while, and your décolleté doesn't bother you, or maybe you wear crew necks all the time and you just don't care, take those lines and put them up here, I would say. Go for what really bugs you, because this is a great deal, and I would do it that way. And you have something to say with that?
I was going to ask you, can you explain what you mean by lines?
Yes. So the treatment lines are when a transducer is on the machine. I don't know if you can grab one out of the drawer over there if you want. And I think it's in the top or second drawer down. So there's the line of energy goes right across. And what's happening is those little pinpoint coagulation of heat goes right in the area that I want it to go to. So thank you. When you're holding the transducer, it's going to be on the handpiece that you guys saw on the patient's face. We're actually treating between this area. So sometimes you're going to think, well, she's treating all the way over here. I can't do that. It's another nerve. There's things there that we don't want to treat. So we're actually working on this area right in the middle up to the points of where we're treating. And when you're looking on here, when you see this side and this side, it's a straight line that goes right across where those coagulation points are taking place in the tissue. And so we're imaging on the screen to see those bright white lines that we talked about. And when we say 3.0, there's the 3.0 of the depth that we're going to. So I hope that kind of explains. When you're doing thermage, you're heating a larger area of tissue, and it's only one temperature and one depth. So it's a little bit different. It's not bad, it's just different. So you have to sort of decide what you like. I mean, some people sometimes do them both. I think it's a little overkill. I don't think you need to do that. But if you think maybe thermage worked better for you, that's okay. You know, it might just be your body's wound heal response that's why we have different treatments here. So you can pick, you know, certainly what is best for you.
I think basically when you say like lines, that's how many pulses. that
Yes.
you're delivering.
How many pulses you're delivering, right? So if you're doing full face and neck, I mean, you're anywhere from 997 to 13 to 1400, something like that. And then you're also doing the amount on the chest, which is, you know, a standard amount. Typically, you don't need to overdo your chest. We have more fatty areas of our face and heavier things to lift. Here, we're really just working on the fine lines and wrinkles. We're not really doing a lifting necessarily. It doesn't breast lift, nothing like that.
Another thing too, like when you say like, you know, thermage is a bigger area, ours is smaller purposely because
Yes.
we want that micro focused energy
Mhm.
super close together so that we're not missing any of the collagen.
Right.
So, you know, that's intentional. We want that. We want those small little areas. We want to make sure that we're able to micro focus that energy on all of your collagen so you get the best results possible and the biggest lift.
I've got a, how long does it last? I mean, everybody that talks about it, it basically, whatever we tighten stays. It's not like I injected anything and your body is then metabolizing it, right? It's just that your body continues to age at the age you are. That's the only thing that I would say. So I do think that you build on them. Similarly to if you did this and then you went and got a laser and they did mostly resurfacing with a little bit of skin tightening, you would then be building on that again. We always encourage you to try different things and sort of put them together as a non-surgical platform. I think it works the best to keep you as healthy as you can. And the other thing here was, have you noticed? Okay. And then somebody asked about their turkey neck. So I would have to see you. Everybody's got something. I actually have had Kybella, and I looked literally like a, oh my gosh, a pelican. I'm not even kidding. And when I moved, it moved. So it will melt fat. It will tighten at the same time, but then you still need a little bit of tightening, you know, with your face for skin. Exactly. So we usually do different things, you know, for you. I would say, come in, let me take a look at you. I probably would then also, you know, get one of the physicians or nurse practitioners, things like that, to take a look, because those are all things I don't do, but we combine very well. And we would get you your little, you know, decisions on what you should try to do there. So if I had face and neck done in September, can I apply this when yes, if you've just done it, and I did not know I was doing this, honestly, in September, to be honest. I knew we were thinking about wanting to do something. We just didn't know when, and it kind of creeped up on us quickly. We'll definitely do something. So I would say, email me, let's figure out, you know, if there's an area that's bugging you, maybe you can schedule it, you know, from this event kind of thing. And I'll try to hold something back for you. And then, you know, you can have it done when you're ready. I don't want to, you know, not have anybody have, the people that are having it done like literally this week that have had it before already know I'm doing this, and I'm giving them the same because they've done it for years. So it's not like if you go to Verizon, you don't get a deal on your phone. I don't want to do that. So I don't want to leave anybody out. I don't want anybody to feel like they're not getting, you know, everything that's deserved for, you know, attending this, because we really want to get the good information out to you guys. So any other major questions, anything you wished we would have covered, you can type it in here real quick if you want to. The cost, what is the cost generally? So generally $3,200 is your full face. Neck is around $1,600. If you're going to do submental down, like let's say you've done your face, but you're like, now I just want to do under my chin one more time in my neck, it's probably $1,800 to $2,000, somewhere in that zone. And then you're going to get the eye and around the mouth free. Well, actually, it would probably be more like eyes here and in the mouth free. So we'll kind of just see like where everybody is as far as, you know, what you want. And again, it's so individualized. If I'm doing, like, I have patients that are tiny, like they're like, I mean, so much smaller, just their skull, their genetic, you know, yeah, so small. They don't need the same lines that somebody like me that's a little bit bigger is going to need. So it's not that I'm trying to make somebody's more, you know, and they're within a few $100s, but it does matter. I mean, I don't want to put a bunch of lines somewhere that somebody doesn't need, because I know it's going to be enough lifting for them. Full face include under the chin? Yes. Very good question. So full face is like 4 fingers under your chin here, right? Up underneath. So it's kind of like this area all the way up. It's going to be under the eyes, around the mouth, lifting. It's a lot. it's a very good place to start. And you can split them up. So if you're like, oh, I want to do it, but I don't know if I want to go through all of that in one day, I would suggest full face. And then you can only do Pronox within 7 to 10 days apart from each other. So I would wait a couple weeks, a week, and come back and do your neck and your chest. And then that's when you'll get your cream free and your free lines and everything on your second visit. Some people are like, nope, if I'm coming, I set aside time and I'm going to be with you. So we do the whole thing. And I'm fine with that. I've done up to 3 to 4 of these in a day. And I'm okay. It doesn't bother me. What is Pronox? So Pronox is half nitrous oxide and half oxygen, and you're breathing in a tube. Like when you've gone to the dentist, you need to be okayed by the physicians. I can't do that, but we want to make sure that it's safe for you. You can drive yourself. It's non-narcotic, typically no inhalers, things like that. And you wouldn't have wanted to have it 7 days ago at the dentist. So when I'm saying, if you're dividing up the treatment, you're going to do face one day and do neck one day, because your pain tolerance is low and you're just like, oh, I get tired, or I don't have that kind of time, you can divide it up, but it has to be 7 to 10 days after, just so that it's all out of your system and we start fresh with new treating with the Pronox. Anything else anyone can think of?
This is being recorded?
Yes, this is being recorded. Yes. Okay. Yep. Is Pronox necessary? I would say no. I mean, it depends on your pain level, right? If you come in here thinking, I have some people come in, they're so scared of me. And I'm like, I haven't even turned the machine on, like, whoa. So, and I do hurt people for a living. It's hard, but I try very hard not to. So, I mean, I would say it is not necessary if you're a stronger person. If you're like, I had babies and I didn't do any, well, then that's way like, or I've done things with Dr. Parker. I don't get numbing for my lips. I don't, some people don't. I mean, some people are like rock stars. Other people are like, I'm the biggest baby. I'm trembling the whole way I'm driving here. And there's everybody in between. So Tylenol is good. I would like for you to not take things that are anti-inflammatory, because I want the swelling inside your skin. Like a lot of times you get the filler in the lips and they say ice, and take all kinds of anti-inflammatories. I don't have you do that because I want the nice little swelling. Can you describe what it feels like? So it's weird. It doesn't, how do I describe it?
Like a rubber band snapping?
Lightly, I would say lightly. Yeah. And because it's gotten better and we're treating you in the proper areas, because now we've got the imaging and we know the levels we're going to, I would say it is not as painful for sure. I'm probably going to get cut off pretty soon. Yes. So I want to thank everybody.
Yes.
Jill G at theparkerclinic.com. But the best is honestly come in and see me. I want to be able to sit with you, talk with you, make sure that what you, are looking for is, the right choice. Thank you to you.
Thank you.
With me today. I so appreciate it. I hope you guys enjoyed it. I know we set a little time there, so it's probably gonna click away. So anything else I don't know I should say? It looks like I think everyone's good. Will you send out the recording at an interruption? Yes, I think she can. Yes. So if you email us, we will send that to you so that you can see it.
You're going to have somebody call them?
Yes, they are going to reach out to you, but you can call and schedule. If you know you want it and you've done it before, the sooner you call, the better, because my schedule is very crazy. I'm not going to lie. If you're having trouble getting what you want, please email me and just say, gosh, I really need your help. I'm struggling. These are the times I can do it. What can you do for me? So I know I have a lot of snowbirds leaving for Florida, and that's a tough one. They want to get it done before they go. Thank you. I appreciate the very informative thing. Email address jillg@theparkerclinic.com. I can check those. I'm glad you thought it was informative. I wish I could describe what it feels like more, but it's really not that bad. I think it's more in our minds sometimes than it's the big time pain. So thank you so much for everyone's time. We're going to go ahead and end. I think we are at the very end. So anything else? I guess I will see you guys in person. Thank you so much for attending.
Thank you.
Take care and stay safe.